I was diagnosed at my mammogram this year that I had done in January of 2020. My mom is also a breast cancer survivor. Hers was actually a different type of cancer than mine. So she had different outcomes and different things going on. With mine being as aggressive as it was, I went my route. After the surgery, I was set up to do my chemotherapy. We had a double drug chemotherapy in the beginning, and it was every other week. And after that was complete, then I went to a single drug chemotherapy that was weekly for 18 weeks.
Cancer is a progressive illness, so if we can find something when it's small and early and confined to the organ it began in this case the breast, then it's basically curable. If cancer is allowed to spread or what we call metastasize to other areas, then the amount of treatment needed for that cure is more, and then the outcome might not be as good. So for example, in the breast, one of the first sites of spread is to the lymph nodes, typically in the armpit area. So if women don't get screened and they just wait till they feel a mass, on average around half of those women have already had metastatic spread in their body. If we can do screening, that significantly reduces the odds that has spread. Generally, for a normal risk population, we recommend beginning screening at age 40, and then we recommend yearly screening after that. There are some groups of women that we would recommend earlier screening, particularly if there's a known high risk, family member, and then people of African ancestry probably should be starting earlier. We definitely find cancer much earlier in the women that get the mammograms. The newer technology we have is actually designed to have an automated compression system so that the discomfort should be diminished and the dose is also diminished. We have the best technology that we've ever had for this. I'm finding cancer smaller and earlier than we ever have.
My last session, they brought the bell out on the decking upstairs, and so my family got to stay down in the parking lot, and the nurses all came out on the deck with me, and I got to ring the bell there, so they got to see it all.
I'm ready.
Everybody that I've encountered along this journey has been great. If I have any questions, they get back to me right away. They always welcome me by my name every day I come in and say, hey, how you doing? I've met some wonderful people on this journey.
I wish people would tell their family members or their friends. Early detection is the best chance for a cure, and we'll do everything we can to find things as small and early as we possibly can, and we're increasingly successful at that. It's a great time to at least consider, getting a mammogram if they haven't already, and if they are, to just be consistent with, getting it yearly at a center they trust.